This is the Gemstar Pump that's used at Ipswich Hospital for patient control analgesia and epidural analgesia. We use the same pump. Today we're just going to run through the basic setup of the pump for intravenous patient control analgesia and how it's prescribed and patient management information regarding that. So just a few basic fundamentals of the pump. To switch it on, you just switch the power button on the pump, which sits on this docking station here. Generally it's best if the docking station's plugged into the wall so that the inbuilt battery remains charged. Unit's just self-testing. Okay, and we'll just press that enter button to confirm that it's running on a battery at the moment. Alright, one of the most important things here is you notice the pump's alarming, and it's because the giving set here isn't plugged into it. So these just plug into the side of the pump like this, and that's it, it's clicked in and there's no more alarming. The program here now gives you some choices. We really want to clear whatever else has been on that pump. So we'll choose option 3 so we can clear the previous program that's been on this particular pump. Okay, now for a PCA, that is the hospital's prescription sheet for patient controlled analgesia, and your prescription today we're going to do a morphine PCA, and the standard prescription is for a 1 milligram dose with a 5-minute lockout. And the fluids which hang above the pump, normally this would have an orange label on it, and the protocol in this hospital is 100 milligrams of morphine in 100 mils of normal saline, giving a concentration of 1 milligram per mil. On the pump now, it's going to ask us to program those parameters, so we're just going to select the bolus only option, which is 0.2, and our solution's in milligrams per mil, so we'll select 1, and the concentration I mentioned is a milligram per mil, and we'll just enter that parameter in there. We're not going to have a loading dose at this stage, so we'll just select no, and we'll set the bolus dose at the standard starting dose for morphine, which is 1 milligram, and the standard lockout is 5 minutes. And we'll enter that, and we usually don't set any limits for this particular protocol. And the container size used here is 100 ml. And we'll just enter that there. The pump now asks you for safety reasons to scroll down using the bottom arrow button to review the program. And the review is complete. Most importantly now is that we have to purge the line of air before we attach it to the patient. The correct way to do that is with this pump. So before we press start, we have to purge this line with the fluid contents up here. So the way to do that before you press start is to press the purge button, and the pump asks us to prime the set, so we say yes, and for safety reasons, if we had to do this another time, disconnect from the patient and hold down the purge key. Sometimes it asks you to do that again. Okay, so the purge function, when you finish taking your finger off the button, we'll imagine now this whole line's been purged. And when you press start now, you'll see on the front of the pump that the pump reads 0, and there's a small locking icon at the bottom of the screen that tells us that the keypad on the pump's locked. It's very hard to see on these pumps. So basically with that, all this should be checked with 2 registered nurses before it's attached to the patient, and also the programming should be checked when you take a patient over, or at least once during your shift. But basically the pump's ready to go, and if we activated that, this patient would get 1 milligram of intravenous morphine. I just thought I'd go through a couple of tips with troubleshooting with the pump. And you're probably sitting there wondering what happens when this runs out. Well, what happens is this pump sets an alarm off that tells you that the bag's almost empty, and then it's time to go with another registered nurse and prepare the infusion. When you do that, this keypad's locked on the pump and we have to unlock it. So the way to do that is press stop, and the unlock code on these pumps is 1234, and what I usually suggest is you take a breath between each press or the pump won't respond. Okay, so now the keypad's unlocked, and when you come with your new bag to put up on the pump, you press change, and then you press the option there that says new container. Place it on the IV giving set, and then press start again, and the machine will be ready to go again. I'm going to back this up now to the start section. Whenever you press start, this keypad locks again. Sometimes the giving set, for whatever reason, can get air in it while it's attached to the patient, which isn't a good thing. When that happens, not all the time, not everything's fail-safe. The pump should register that there's air in the line with an alarm, and the thing to do then is to disconnect the giving set from the patient and use the purge function that you were shown earlier to purge the line again while it's disconnected. Because of different things about the pump, sometimes that's not always possible and it won't let you do that. So another thing you can do is press the black button at the top of the pump and remove the giving set, and make sure you disconnect it from the patient. Now inside the cartridge there's a white switch there, and if you press that down like a light switch and squeeze the bag continuously, you can purge the line in that fashion, and then reconnect it to the patient after you've placed it back. The pump's always going to alarm while this cartridge is not placed in the pump. Therefore, whenever you're ceasing a PCA, you need to have the cartridge in the pump. That will stop alarming now. And then you need to stop it and hold the power button down until the pump's switched off, and then you can disconnect your line and discard it in the presence of another registered nurse. So that's the basic fundamentals of the pump. When someone has one of these, it's really important that they have a referral sheet to the acute pain service, and that's usually has to be filled out by whoever initiated the device. Managing a patient with one of these pumps, The management details are always recorded for you on the front of the observation sheet. So at least hourly observations for 8 hours, and then second hourly for 16, and then 4 hourly after. And sedation score must always be a component, and oxygen saturations, because the sedation score is going to increase if there's going to be any problem with respiratory depression. That's going to happen well before a decrease in respiratory rate. There's also protocols there for program checks and line checks. And when you come to do your observations, now that the hospital has other forms to record the basic vital signs, you record them on the other document, but it's important that on this one you record sedation score, oxygen saturations, pain scores, your infusion rate, and the cumulative dose demands and deliveries. You can get demands and deliveries easily anytime by pressing help on the pump, and the cumulative dose is just the reading of how many milligrams is on the front of the pump. And there are other boxes there for program checks. So that's an important legal requirement of managing patients with patient-controlled analgesia. There will also be other analgesics prescribed, such as regular paracetamol and sometimes other tablets like non-steroidal anti-inflammatory drugs. But if there's any problems with PCAs, the contact number for the acute pain team is 7930 via DECT phone, which will get us 24 hours a day. So I hope that helps you out with understanding the pump.